We're now going to start chapter 6, which deals with the parasites. Now, before we start the chapter, I just want to let you know that some of these you can almost guarantee are going to show up on step 1, and then others probably not at all. So what I'm going to do is try to focus you on the ones that are higher yield for step 1, and we may only briefly discuss the ones that are probably fairly low yield for the step 1 of the USMLE. Now, the good news to everyone usually is that you don't have to know life cycles here, okay? So what you need to focus on as we go through the chapter is you need to focus on how you acquire the disease, okay? Is it fecal oral? Is it by penetration of intact skin, for example? What does the disease look like, if it's even symptomatic at all? And how you're going to diagnose it. So those are the things you really want to focus on as we go through the parasites. Okay, so what I'm going to do is just give you a little bit of an overview of some of the protozoans versus the metazoans, and then we're going to talk about them specifically as we move through the book. Okay, we're going to first talk about the flagellates and the amoeba, and some of the important organisms here are going to be entamoeba, trichomonas, and giardia. Okay, Naegleria and acanthamoeba are amoeba that sometimes show up on step 1, but again, we're going to place those a little bit lower yield than entamoeba, for example. As far as GI and GU infections, trichomonas and giardia are both pretty high yield, but as far as leishmania and trypanosomes, probably fairly low yield, okay, for the USMLE. Now the apicomplexa, we're typically talking about Plasmodium, which is malaria. That is always high yield for the boards. Toxoplasma, which is also going to be high yield for step 1 of the USMLE, and Babesia, okay. Babesia is also fairly high yield for step 1 because it causes co-infections with Lyme disease. So it's actually a fairly common disease as far as a parasitic infection in the U.S. The GI infections are also going to be important, but those are going to show up predominantly in AIDS patients, and those definitely have found their way to step 1 USMLE. Now, the different types of worms, the metazoans, we have the flatworms, okay, your trematodes, cestodes, and then our roundworms. The roundworms being the most worm-like of the group. And again, we're going to focus on the ones that are really clinically relevant. For example, like Anaerobius vermicularis, which is one of the leading nematode infections in the United States. And we may just mention some of the other worm infections because all in all, they're not as common in the U.S. All right, so definitions, just so we're all on the same page when we get started. There are 2 types of hosts in a parasitic infection. There's the definitive host and the intermediate host, all right? When you are functioning as the intermediate host, sometimes things get a little bit messed up, all right? And so we're going to see a little bit of a different presentation of the disease than we perhaps normally would. The vectors, of course, are similar to vectors we've talked about before. So you can have both mechanical vectors and biological vectors. And again, we'll talk about those as we move through the different parasites.